I want to pause here for a second and step into a conversation with you as you're talking to your patients to really help you engage with them and understand the severity of this condition. You see, obstructive sleep apnea claims lives every single year. No difference than car accidents and heart disease. And maybe those numbers are slightly different, but what we're beginning to understand based on the research is how prevalent sleep apnea is in the cardiac disease community. Patients with hypertension, congestive heart failure, we could go down the list. So to say that obstructive sleep apnea is a condition worth talking about, that pretty much explains itself. But I want to go a step further. You see, we've coached multiple clients across the United States on the conversation and the way that they communicate with patients, the verbiage they use, the way that they talk to them, and help try to create this sense of urgency and understanding the patient's need, not the practice's need, not your need, but your patient's need to move forward with treatment. And maybe it's not your treatment, but to treat their condition. So I would encourage you to step into that clinical conversation with confidence, knowing that apnea causes many of these conditions or is present with many of these conditions. If you think about it, the increased pressure that is put on the heart to work extra hard, beating faster and slower and up and down, and the heart rate variability throughout the night due to these apneic episodes, you can imagine the wear and tear that that puts on our cardiac muscle. So understanding how that plays into the patient's overall life, they don't know what's going on because they're sleeping. But again, I want to encourage you, step into that conversation with confidence. If you need the stats, go grab the stats. But usually what your patients need is a caring provider with the confidence to communicate with them what's really going on and why you care. So don't forget that, and don't hesitate to use life-threatening condition because it truly is.